If you're someone who's been dealing with a voice disorder like Parkinson's, essential tremor, vocal fry, vocal nodules, dystonia, in today's video, I'm going to be talking about potential treatments for these voice disorders. So if you're interested in that, then definitely keep watching. What's up guys, and welcome back to my channel. If you're new here, welcome. My name is Destiny and I'm a licensed speech language pathologist. Some of you have asked about essential tremor, some of you have asked about dystonia. There have been a variety of other voice disorders that you guys have talked about. So I'm hoping that in this video I can give kind of a broad overview of some of the ways in which treatments can occur that can kind of help all of the things that you guys have asked about. There are many ways that someone can kind of stumble into a voice disorder, whether it be through tremors from something like essential tremor, where different parts of the system are impacting the way the voice sounds, or Parkinson's, where the hallmark is being very quiet and kind of imprecise with their speech. Just keep in mind that every voice disorder is going to have a slightly different cause. But the thing that unites most of them is that the voice is not clear, it's not loud, it's not flowy, and so that's going to be the focus of the speech therapy that I discuss. If you're someone who is experiencing any of these disorders, I first encourage you to go and talk to your doctor about that. Do not use this video or any YouTube internet videos to diagnose yourself or to treat yourself. Go to a doctor first. The first way that a doctor may treat a disorder, and again it depends on the cause, is through some sort of medication. Some of you guys have left comments about the different medications you are on. I've heard of using, different anti-seizure medications, different like muscle relaxants. It all depends on what is causing the voice disorder. Another avenue is actually Botox. And again, this depends on the type of voice disorder, but disorders like dysphonia or tremor can respond to Botox. In some cases, the Botox completely gets rid of the voice disorder, but one of the downsides is that it comes back. Botox doesn't last, and so you have to constantly, like every 3 to 5 weeks, go back and get more Botox to treat that voice. So there's definitely going to be things that you're gonna wanna do on top of that if you're getting Botox and it's helping. Okay, so let's talk about how a speech therapist can help. The first way that a speech therapist can help is through teaching you vocal hygiene. And this basically involves doing things that either encourage vocal improvement or more likely discourage vocal harm. So you're going to be doing things that don't make your voice any worse than it already is. Some of the things involved with vocal hygiene include drinking more water, not smoking, not yelling, not overdoing it, not speaking so much that your throat hurts after, practicing deep breathing, because breath support is incredibly important when speaking. You can't speak if you can't breathe. You're not going to speak well if you're not breathing well. Now, I'm going to talk about some different treatment approaches. One of them is more of a parts to a whole kind of mentality. The other one is more of a holistic approach to therapy. The first one that I'm going to talk about is something called Lee-Silverman voice treatment, or LSVT. LSVT was developed specifically for patients who have Parkinson's disease, but this sort of treatment can be helpful for a variety of voice disorders, and that's why I'm covering it today. There are many parts to LSVT, so let's go through a mini LSVT session. The first thing that we're going to do is deep breathing. Breathing is really important for a nice, strong voice. So we're going to put our hands on our belly and we're going to take a nice deep breath. And you want to feel that belly come out and back in. Ready? I just wanted to pause here and point out any of you who have seen any of my other videos and still haven't subscribed to my channel. Please, if you enjoy my content enough to watch multiple videos, please consider liking this video and subscribing to my channel. It helps me reach a bigger, wider audience, and my goal here is to help as many people as I can. Now let's get back to what I was talking about. The next thing we're going to do is add what we call phonation. Phonation is just turning your voice on. We want to take a deep breath and say ah as long and as loudly as you can. 1, 2, 3. Ah. Wow. Now, I'm really not a singer, but I'm doing this for you. The next thing we'll do is refer to stretching. We're gonna go from a neutral ah to a high ah. And we're gonna be stretching the vocal cords as we do that. So let's give it a try. 1, 2, 3, go. Ah. Now we're gonna do the same thing, and this time we're gonna go from a neutral to a low pitch. The same thing is happening. We're stretching the vocal cords. Ready? A nice deep breath, and then we're gonna start. 1, 2, 3. Ah. Those are kind of the parts that make up a nice clear voice. The next part would be carrying that over into conversation, because we don't just go around making notes, right? We go around speaking in full, beautiful sentences. So what you might do is come up with a few short phrases and practice that nice clear voice in conversation. I've already come up with a sentence, so we're gonna practice that. This is the sentence here. We're gonna take a deep breath and then we're gonna say this sentence. Ready? 1, 2, 3. We went to dinner at the mall. And try it again. We went to dinner at the mall. That's just a small snippet of an LSVT treatment session. If you're interested in this and think that it might be helpful, I would definitely recommend searching for a speech therapist who's specialized in LSVT. Another treatment is called conversation trained therapy, or CTT. Now, as the name implies, it has to do with training your voice in conversation. Now, the theory behind this treatment is that you want to practice the voice in its natural environment. In this style of therapy, what they may do first is come up with a clear speech strategy. The therapist may ask you, think of someone who speaks incredibly clear, who over-articulates, who you would imagine is a great speaker, and then try to imitate that. Now, most of us have ideas in our mind, whether it be like a preschool teacher or a pastor. We would automatically have someone in mind that we could imitate. You would change the way that you spoke in order to be incredibly intelligible, like this. Then the therapist might ask a question or give a prompt, and then the patient would then use that clear speech strategy to answer that question or respond to that prompt. The next thing the therapist would try to do is build an awareness between the original voice and the new clear speech voice. So the patient may go between both interchangeably in order to bring more awareness to what they're doing different. Now, in order to practice the difference between the two voices, you would go back and forth like this until you hear the clear difference between the original voice and the nice clear speech voice. Some of the tips that a CTT therapist may recommend are for the patient to start to feel the mouth sounds and to bring each speech sound forward. You want to feel what the articulators are doing in the mouth. They might recommend stretching out each sound as you say it in order to really bring awareness to the articulators. So if you're saying this sentence again, you might say, we went to dinner at the mall. I typically don't work with voice patients, but I've seen videos of the difference between how they started and how they finished with this therapy, and it's amazing what they can do in just one session. So if you're interested in CTT, I would definitely recommend finding a speech therapist who is trained to do this style of therapy. I just want to take the time to thank each and every one of you who like my videos, who comment below, who leave insightful comments. It definitely helps me grow as a therapist and as a creator. I am paying attention to the comments and the questions in the comments, and I just wanted to let you guys know that I do have some future videos coming out to address some of those questions, because I think enough of you have asked the same questions again and again. So if you haven't subscribed yet, I would definitely recommend doing so that you don't miss out on those future videos. All right, guys, I'll see you in the next video.